very much, Professor Collins. Okay. For your introduction and the opportunity to speak at your prestigious conference today. Is that Rebecca? Yeah, thank you very much. Cancer is a word that actually brings dread to our hearts. But the good news is that cancer today, occupational cancer anyway, is preventable. And nowadays the prognosis for cancer sufferers is getting better. And we need to make it possible for cancer sufferers and survivors to remain in work. And that's what I'm going to talk about, how the IOSH practitioner can help with this process, and finally mentioning some prevention campaigns that IOSH is involved in to stop this needless loss of life. I won't be repeating what Malcolm has said this morning to us. Here you see these figures, but there's actually three things you need to remember about these figures, and the first thing is that they're an estimate, only an estimate. It's actually very hard to determine the exact number of global work-related cancer deaths. Also, 2/3 of these occur in the low and middle income countries, and the last thing we need to cover is that a large proportion of these are due to occupational cancer. So there is something we can do on prevention side. The main problem with estimating the number of cases of occupational cancer is the fact that it's latent disease. A worker might be exposed to the cause of cancer and not develop any noticeable symptoms until many years later. And also, these days, workers don't stay with one company. They move between different jobs. So it can be very difficult to determine exactly when they were exposed to a carcinogen. And in some countries, there's lots of informal workplaces that aren't inspected. And then it's very difficult to separate out occupational cancers from other cancers. Because, of course, lifestyle choices do make a difference. We all know about smoking, alcohol use, poor diet, lack of exercise. And we all say, oh no, we will do more exercise, we will go on that diet tomorrow after the conference is finished. But it's quite hard to actually physically do that, and that's why we need to promote health as well in the workplace. And this prevention is very important as well of occupational cancer, because it's cost effective, it reduces high medical and other social costs, but also because it can reduce the suffering of many potential cancer victims. I thought it was just worth mentioning how workers are exposed to carcinogens, because if we know this, we can prevent it happening, and often it's not that difficult. Occupational carcinogens are of three types. We've got the chemical carcinogens, which occur naturally, like asbestos, or it might be the result of processing, such as vinyl chloride. Then we've got the physical carcinogens, such as ionizing and ultraviolet radiation. And we've got biological carcinogens, like viruses, things that cause the cells to change, and therefore make us vulnerable to cancer. And carcinogens, of course, can occur as solids, liquids, vapours, gases, or dusts. So workers can breathe them in, or they can absorb them through the skin, or in fact they can swallow them. And this highlights the importance of good hygiene in the workplace. We don't want workers eating their sandwiches on the factory floor or taking snacks without washing their hands. I can't emphasise enough that hand washing is actually really important, such a simple thing, and that even that can help prevent cancer. And of course then there's the importance of protective equipment, and I'll be touching on this a bit later on. I'm not going to go into this into detail because Malcolm spoke about this, but I just want to point out one particular type of thing that we need to be alert to, and that's emerging technologies. They're providing us with new challenges, particularly carbon nanotubes. They're a new form of carbon fibre. They've got a diameter in the nanometer range, but lengths of hundreds of microns. And the problem with these is they're quite rigid. If you inhale them, they get stuck in your lung, a little bit like asbestos used to. But of course we don't know at the moment whether they actually cause cancer. But we don't want to wait until we know. We don't want an epidemic like we've got with asbestosis and cancer, asbestos-related cancers. So it's quite important to be taking steps at this stage to limit exposure of workers to nanotechnology. And a lot of research is being done at the moment in this area. As I mentioned earlier, advances in diagnosis and treatment have meant that survival rates have increased for cancers, and this means that more individuals that have cancer are staying in or returning to work. But the long-term effects of cancer or treatment can mean that employees may continue to have physical health problems, which can affect their ability to do their usual work. So it's quite important to be flexible. And getting back to work after a diagnosis of cancer or staying in work during treatment is really quite important, because it's a matter of re-establishing or keeping hold of a normal, healthy working life. You know, you don't want to join the cancer club. You want to stay in the mainstream. And that's why, for OSH practitioners, it's quite an important role to help these people stay in the workplace. And research has shown that work's very important for self-identity, self-esteem, providing financial security. Cancer is a very expensive disease to have, even in the UK. Just the cost of getting to hospital to have radiation treatment or to have chemotherapy. It can take, if people have lost their jobs, it can be very difficult, even in the UK, to afford to go and have this treatment. And sometimes, of course, it isn't just possible to continue in the same job, because cancer reduces a person's physical capacity. And this means that cancer survivors with less education, who are doing manual jobs, may be less likely to return to work than those who've had a higher education. And as expected, survivors with more physical symptoms, they work less hours. Having chemotherapy can be a significant predictor of job change following cancer, possibly due to fatigue. And there's also reports that chemotherapy can induce cognitive impairments such as memory and concentration problems, which can make it difficult to carry out decision-making and planning. And this may impact on the type and level of work that some cancer survivors can do, and it may have implications for workplace safety. But again, this illustrates the importance of having a plan and working flexibly around the employee. Cancer survivors who've been given workplace adjustments are more likely to be able to return to work. But then sometimes their co-workers or supervisors underestimate their ability to cope with their work. It's fine when they're off sick, they're sending cards, they come back to work and everybody thinks, oh, good, he's back to normal. But it's not always the case. Therefore, it's very important to raise employers' awareness about the workability of cancer survivors. One of the most important roles for the OSH practitioner is to help prevent employees getting injured or becoming ill in the first place. And one of the traditional roles, of course, is identifying potential carcinogen substances used in the workplace and developing control measures to prevent exposure. And it's important as well to ensure that the controls are being correctly implemented and carry out proactive monitoring. We've heard from the previous speakers about the importance of controls. If cancer-related symptoms are detected in the workplace, then you need to look at your systems again that you're using to control exposure to known carcinogens. But you've also got to remember that it's because of the latency, it's possible that the exposure didn't happen in your workplace. Leadership is very important as well. Identification and implementation of controls should be regarded as a priority by senior management and supervisors. A newer role for the OSH practitioner is actually in health promotion, particularly in the UK, and rehabilitation. OSH practitioners are often in a very good position to notice changes that happen on the front line. And there are a number of ways that can help in the diagnosis and rehabilitation process, and I've listed these on the slide. For example, looking for early signs of distress, low morale, that sort of thing. It's very important to seek competent help from others, for example, a medical practitioner, a human resources department. This depends on the size of the company. They can assist with return to work procedures and provide ongoing support to enable the employee to feel safe and productive. And it's very important that a rehabilitation programme for absence due to cancer-related illnesses includes effective procedures for overseeing the rehabilitation process. So you'll need your policies, your training for the managers, early contact with the worker, etc., and agreeing a flexible return to work. A work adjustment assessment would normally be carried out by the employee's manager, together with the employee. But it's important as well to make sure that all these decisions are documented and in line with legislation. OSH practitioners, of course, are often more comfortable with environmental solutions, but it may be that work adaptations will lead to physical ones. Because if we're using just the medical model, that only thinks about illness and getting better, rather than being healthy as a continuum. And you're not either ill or healthy. If everybody waited to be healthy before they went to work, I don't think many people would ever go to work. And this is why it's important to use a biopsychosocial model and consider the worker, their health problem, and their work environment, and try and balance everything together. Research has shown that good health is good work is good for you. It's good for your health. Healthy workers are good for business, because if they're not healthy, they're going to cause you costs. But we need to get work as well into perspective. Achieving a work-life balance is a lot more important when you've had a serious illness. And I know that from my own daughter, who's been ill for the last 10 years now, that she's managed to return to work. A very unusual thing to return to work after such a long period of time. And her hospital has been very good at providing flexible work conditions for her. So this shows that it can be done. It just needs a will, really. I just wanted to talk a bit about communication, because our first speaker spoke about this. It's very important to get health and safety integrated into everything. So the IOSH practitioner needs to actually talk to anyone who can make things happen, including contractors within the company. And they need to make what we call functional alliances within their own organisations to make sure they're part of the discussion. If you're not part of the discussion, you can't influence the outcome. And health and safety can be regarded as very complex, and it's one of their roles to actually simplify the messages that are coming through. Sometimes it's useful to concentrate on what we call early adopters. You often get one or two people in the company who are very keen and can encourage new things. And if you can get them on board, they can spread the messages for you. It's also important to keep abreast of new technology, because if you're ahead of the game, then you're going to add value to the decision making and achieve the best solution for employees. Now, Malcolm already told you about this campaign, so I'm not going to repeat that. That's one of our biggest campaigns at the moment, and as he mentioned, we are doing a literature review on shift work at the moment, shift work and cancer. This is a previous campaign that we have that's still running, and it's called Life Savings. And in fact, I think some of this has already been translated into Macedonian. And there's case studies, quizzes, illustrated leaflets, etc. But these resources contain ideas that could be adapted for your own countries. And finally, I wanted to mention one project that I'm involved in at the moment, and was previously involved in originally. This campaign first launched 5 years ago, and it's a cooperation between the enforcer, the HSE, and IOSH, and a lot of representatives from companies concerned with respiratory health. And it was very successful, and what we've done is, after 5 years, because technology's moved on, we've been meeting over the last 9 months, rewriting material, and we're going to launch a website with links to free materials, all sorts of information, posters, and the aim is to help people raise awareness in the workplace about the way in which you should use and select respiratory equipment. It's very important because often people can be provided with masks and things, but they don't wear it correctly. So that's what that campaign is all about. So to finish, we've got to think about the importance of education and awareness raising about the burden of occupational cancer. We've got to make sure companies are receptive to messages about occupational health, and we're keen to implement solutions. But also important, we've got to upskill these IOSH practitioners in the workplace to take a fuller part in the rehabilitation role. And it's about building bridges, between the professionals to ensure the needs of the workforce are met, so that prevention and early detection of occupational cancers actually become the norm. Thank you very much.
Благодаря, госпожо Joyce, на вашето истрпно излагање и на овие факти кои што може би сите не застрашуваат, меѓутоа јас би рекла дека и покрај опасностите и ризиците кои што ги носи работното место во насока на заболување од професионален канцер, денеска живееме во толку стресни услови воопшто во животот, не само во работењето, така да оној дел враќањето на работа на луѓето кои што се заболени од канцер, навистина треба да биде наша задача. Дали имаме прашање од аудиториумот?
Mogu na engleskom. Želim se samo da pitam i Joyce i gospodina Balkona, da li je bilo primjera u Velikoj Britaniji da su poslodavci na neki način kažnjeni za loše postupanje u smislu kancer? Da li su morali da platiti troškove lečenja i tako dalje? Znamo li jako teško utvrditi vezu između radnog mesta i kancera koji može se posle 20 godina, kako ste vi rekli. Me baš interesuje što je to nemoguće u Srbiji vršiti i kako je, da li je to veliko stepno i nema preparacija kao što ste Velikoj Britaniji.
Malcolm can answer this as well. I would say, not generally occupational cancer, but certainly in asbestos, we can get compensation. Is that what you mean? So,
there have been many prosecutions for asbestos. There have been ones for silica as well, and that then opens up the avenue for the individual or the families of persons dead to claim compensation through the courts, but they're kept totally separate. If a company is trying, and there have been quite a lot of cases recently of companies being doing. There was a director sent to prison only 3 months ago for allowing a worker. The worker didn't die, but he was given asbestos cement corrugated panels to fix a roof, which is totally illegal, has been in most countries, and he was sent to prison for, the director was sent to prison for 14 months. Now, the insurance companies will log the individuals who are working in that area, so that in the future, if there is an issue with cancer or some forms, then will be able to sue. But yeah, there are quite a lot of cases of they're kept separate. The prosecution for a criminal offence, as in being exposed to asbestos or whatever it happens to be, is one thing, and there are a lot of cases that are going on at the moment and things like that going on. Probably the biggest issues for in the UK we haven't quite touched on is people being exposed to the effects of bad installations of gas systems, carbon monoxide poisoning. They're almost on a weekly, I get a report every week from the Health and Safety Executive, and almost on a weekly basis there are companies or individuals getting taken to court for being illegal gas fitters. They haven't gone through the proper gas safety training and they're installing systems without putting the proper ventilation, etc. And that can lead to all sorts of problems. That just kills you very quickly if you don't do something about it. But yeah, I mean, if you go to the Health and Safety Executive in the UK, it's the hse.co.uk. If you go into their website, you can get a section of it that gives you all the current prosecutions. I mean, on a daily basis, I get emails through telling me who's gone to court and what the fines have been. Does that help that answer your question?
Благодаря. Јас се извинувам, ние ќе поминеме кафе пауза, така вака продолжиме. Би сакала да се заблагодарам на сите презентери, апсолутно на сите присутни овде, на успешно завршената сесија и согласно протоколот да се поделат сертификатите за учество на презентерите, а јас би ви замолила и за една заедничка слика на крајот на презентацијата од страната на БИБАК. Благодарам.